Is this format censor-proof? Hi, it's time for your weekly update, Common Sense for COVID. We're looking at the week of 5/17/20. I'm hoping this format is censor-proof. The reality is I've seen a lot of physicians offer more controversial opinions than I do on YouTube or Facebook and not be shut down. So I'm going to follow their lead, if you will, and see if we can get solid information out there without offending the YouTube gods. And hopefully we'll be able to do that. Again, I'm just looking to get some common sense to all of these. The reality is a lot of this, you talk about opinion, you talk about a lot of these different viewpoints, but the reality is this is fact. And so I'm really hoping to draw that out and really speak to facts with this video. So with that, I want to start actually with some positive news. The reality is we've flattened the curve. Now, a lot of effort went into COVID-19 and making it what it is. And I'm not talking about constructing the virus. Again, that's still up for controversy and so forth. But the reaction that's happened, there's been a lot of effort that's gone into it. And we have to remember that the original goal was to slow down the rate of the contagion to the point that hospitals and medical staff could keep up and therefore minimize the deaths. The reality is some of the early projections looked at millions of people being in the hospital and millions of deaths from COVID. Fortunately, again, some of the positive news, that hasn't happened. Again, initially it was thought and promoted that we would fail. And if we look at this article from from USA Today, it talks about the fact that hospitals would be overwhelmed and there would be too few beds and again, too few ventilators. And again, in positive news and gratefully so, we flattened the curve as far as that's concerned. And then if we also look at the curves, if you will, from many different places, we look at New York City, Louisiana, California in this graphic, and so forth. We see those curves starting to flatten and not have such a steep slope. The reality is, again, we've got to realize that the possibility of getting zero deaths out of this is impossible. We're going to have people who die from this, just like people die from influenza every year. There are people that are susceptible to these type of diseases, and if it wasn't these type of diseases, it might be something else, and usually would be something else. And so, the reality is, getting the number down to zero is an impossible goal. We just have to understand that. But the hope was that we would flatten the curve to the point that the hospitals and ventilators and so forth that were necessary to save those patients that could be saved would be available. And I think that's possible. And I'm not possible, I think that's happened. The reality is New York now reports that it has more than enough beds and ventilators. And again, I want to maybe just talk a little bit about what's happened in New York. There's been a lot of interest and a lot of focus has happened on New York City, and I would say rightfully so. But the other real fact is that New York City's medical system really works right at the limit. It already runs at or near capacity. They really run a slim line, and I'm not saying that's right or wrong. Please don't take that either way. The reality is that's where they manage their system, and just on a day-to-day basis, they run very close to the cuff. And so any bump, any change such as COVID or those type of things really has the potential and did push their system to the very edge. But again, fortunately, because of choices that were made and what have you, we've really had the opportunity to flatten the curve. They've gone from it doubling every other day to doubling about every 6 days, and they're looking to get it to every 8 days. And this is great news. Again, right now, it appears there's enough ICU beds, enough ventilators for those that need it. We know that on April 27th, the Navy ship Comfort ended its COVID-19 operation in New York City, and we see that article here. We see this article from the New York Post that said only a fraction of the ventilators that they thought they needed were actually needed, which is, again, great news. That's from 4/8/20, so April 8th. To that point, actually, New York City actually shipped 400 ventilators to Massachusetts. We can see that in this article. And New York City also shipped 100 ventilators to New Jersey. And again, great news that there was enough, great news that there was a surplus, and now they're reciprocating by spreading some of that ventilator abundance, if you will, around the country. So good. And again, the U.S. seems to be getting a handle on infection rate and hospitalization, and the death rate is slowing. Now we look at this article and we say this graphic, and we see the same thing. The reality is most countries have started to really flatten the curve and really get it to where it seems to be not climbing so rapidly. Again, understand a zero curve, a zero death from this is realistically impossible. Again, if it wasn't the coronavirus, they may have passed away from influenza, high blood pressure, cardiac disease, and we may touch a little bit on that later and bring that into full circle, because the patients that are passing would have passed. I saw a recent article, and I apologize, I'll try to remember to put that in, but a recent article that said that 99% of all the patients who died in Italy actually had pre-existing comorbid diseases. I actually quoted an article on one of my previous blogs from the American Medical Association that said that 97% of 5,700 hospitalized patients in New York City actually had one of three disease processes. That was hypertension, diabetes, and obesity, and many of them had all three. And so again, we have to look at these numbers from a very realistic standpoint. Common sense. It's similar to we look at risk management from all sorts of different players, and that's cars, vehicles, flights, travel, those type of things. We really need to look at risk management and trying to do that. Now, I want to emphasize the fact that flattening the curve doesn't mean we will not be exposed. It prolongs the exposure rate. And I don't mention this to frighten anyone. Remember, this is common sense. And the reality is I want to keep things as positive as possible. Flattening the curve means that we spread out the distribution over a much larger period of time. It prolongs the exposure rate. But I really pull up this graphic from the University of Michigan that talked about these two different types of curves, and you can look at the article as well. But if we look at how many people were sick at once and how long the virus has been spreading, you can see that blue curve really takes a sharp up and a sharp down, and that was really what concerned us, was that there would be an overwhelming number of patients that were sick, but not only just sick, extremely sick. And then you can see the line there that delineates how many very sick people hospitals could treat. And so by flattening out that curve, we've changed that demographic. Understand though, and if you look at this and do the mathematical equation, the reality is the space beneath the blue curve and the space beneath the yellow curve are the same. What that means is that the reality is exposure, the numbers of exposures they predict should be and will be the same. And we'll talk about why that shouldn't be very scary to us. But the reality is what this does is it allows patients who are very sick and need hospitalization to get the care they need rather than it being overwhelmed. So again, the curve has been flattened. Okay? Well, now what? Well, if you then start to look at epidemiology and talk with epidemiologists, now those are doctors, physicians, PhDs, what have you, that study the spread and sequelae, or the results of disease. And they state that for us to conquer COVID-19, there must be something called herd immunity. Herd immunity must be met. And what does that mean? Well, herd immunity, also called the herd effect, community immunity, population immunity, social immunity, what have you, really it's a form of indirect protection from infectious disease. And it occurs when a large percentage of the population has become immune to a particular infection. Now that can happen in two critical ways. The first is through previous infection, and then they develop antibodies, and then they are not susceptible to the disease again. Now, that's a key point. They're not susceptible to the disease again, both to contract it, but also to spread it. And so they become, if you will, immune from not only the disease symptoms, but also spreading it to others. And that's the key point, is once they've had it and developed antibodies, they won't spread it. And so they can come in contact with people who have it, they won't contract it, and they won't take it to someone else. So that's the first step, the first way. The other is through vaccination. And again, I'm not against vaccinations. Vaccinations throughout time have saved millions of lives. That is a statistical medical fact. But I also think that vaccinations, maybe the pendulum is a little too far on one side, and looking for vaccinations to help us with this may be a little bit misplaced. And let me explain why. And I'm just going to quote one of the research articles that I talked about earlier, which is the fact that the virus is mutating. And so the vaccine that we create may not actually be effective against the vaccine that we deliver. And we see this, unfortunately, with the influenza vaccine. Again, not saying I'm pro or con influenza vaccination, not saying pro or con COVID-19 vaccinations, but just stating the fact that it mutates and changes, and so sometimes success can be variable based on those mutations, and we just need to be aware of that. It still comes down to the fact that we need to do everything that we can to protect our immune system, and we'll talk a little bit about that later, and we have talked about it before, so please review some of those previous videos. So let me get back to herd immunity. So this means that a minimum of 60% and preferably 80% of the population is resistant, immune, or unaffected. That's what herd immunity really stands for. And you can see this graphic here. This is actually from Wikipedia. It does a great job of describing what happens. People who are not immune and exposed and so forth, and they spread things like crazy. And eventually it gets to the point where you can have a lot of a few infectious people surrounded by people who are previously exposed, vaccinated, or unaffected, and again, they will then form an insulation barrier of sorts to spreading the disease around. And so it works very effectively. And the reality is, this is basic epidemiology 101. This is the practice that we followed with MERS and SARS. We followed this with the swine flu and what have you. And that really is the practice that I think is going to make the most sense here. So with that understanding, we need to then say, okay, what are the statistics as far as survivability? If we know that the curve is the same, if we know that means, I should say the area below the curve is the same, and that means that the expectation is that 60 to 80% or more of us will become infected at some point or exposed at some point, and develop antibodies. Now we need to start looking realistic at what the survivability is. Now, there's a lot of data, and sometimes it's contradictory. So I want to try to make sense of this a little bit. So there's a little bit of erratic data, and it can be confusing. And the other thing that's really hard is early data is always bad data. Early information is always bad information. And as we get more and more information, the more clear this will become. We're starting to collect data from a lot of different countries and so forth. And the other reality is we're starting to test more. And so we see what the spread is versus the death rate. That gives us what's called mortality. So as we look at the ways that we're measuring the burden of COVID-19, we really want to look at its mortality and what it's doing as far as the patients who pass away. And then that gives us an idea of what survival rates are. So fatality ratios, it's the number of deaths divided by the number of confirmed cases. So as you can tell, if the number of deaths divided by the number of confirmed cases gives us the mortality rate, and then inversely the survivability rate, then testing really gives us a good image, or gives us one of the key data points that will help us determine what that reality is. So if we look at different countries and look at their mortality rates and so forth, the reason we're seeing such huge variability is because of differences in the number of people who have been tested. With more testing, more people will be identified, and that will identify a lot more mild cases and people who had zero symptoms or so forth. This lowers the case to fatality ratio. The demographics, for example, mortality tends to be higher in older populations. And so if we look at some of these other populations or other countries where maybe they're a little more aged, if you will, we're seeing a lot higher death rate in those countries. And some countries have a lot more risk factors for coming down with colds, coughs, and so forth. And that makes them more lethal, or the mortality rate higher in those countries. The next, there can be some characteristics of the healthcare system. For example, if hospitals became overwhelmed, which they were in several European countries, mortality rates increase. And they increase because there's not sufficient help to help those patients get well and recover. And finally, there are some risk factors that we don't know yet that we're still going to uncover as COVID-19 becomes forward. And so again, there's this article here, coronavirus, that talks about the mortality. So you can research that a little bit. So again, when we calculate the mortality rate, we need the number of actual cases. That's the number that's eluded us a little bit. And then we need to look at, based on those actual cases, what the death rate is. And one of the other things is we need very accurate reporting as far as the number of deaths. We've seen a lot of variability, and we've seen those numbers change from state to state, where some were included or some were excluded as far as death from COVID is concerned. So based on that information, we can start to get mortality numbers. Now, if you look at this research from Worldometers, if you will, the best numbers we have currently state that COVID has a mortality between 0.5 and 3%. 0.5 and 3%. And then again, you can look at this Economic Times research from India, a couple of different research articles. I've got 3 of them there that really talk about this. And one of the most definitive, again, this Worldometers, if you will, talked about the fact that if we look at the actual recovered cases and we extrapolate then estimated actual cases, and then look at actual deaths, we really are looking at a survivability rate of 98.6%. So let me repeat that again. 98.6%. That means that if you come in contact with the disease, if you get sick, if you get exposed to coronavirus, oh my goodness, you're going to survive at a rate of 98.6%. That's 98.6%, just in case you're wondering, and then just so that I can make it very clear, that's 98.6%. Again, huge, good news that we really need as far as moving forward and what we need to do, moving past our fear of coronavirus. So I'm going to go back based on that. So now that we've talked about what the expectation is, what we really need to be watching, what the survivability rate is, I'm going to really focus again back on my original plea, which is we need to do everything we can to prepare our bodies and to prepare our immune system so that it can either fight off the virus or react to the vaccine that is given. So first and foremost, the reality is one of the most powerful things with helping your immune system is sleep. And it's one of the things that we tend to miss out on and tend to compromise on. So sleep reduction, I've got a really good article there as far as sleep reduction. Stress reduction, so reducing your stress. I think psychologists are some of the best as far as looking at stress and stress reduction. So Simple Psychology has given us some results there that talk about how stress and stress reduction affects our immune system. So reducing stress. Exercise. Scientific Daily has a great article on us exercising and how that really bolsters our immune system. Exercise needs to be a daily phenomenon. Yeah, a phenomenon. Boom, that happened. Hydration and using good electrolytes, solid electrolytes, and avoid the hydration and electrolytes that's really sugary. Really good quality electrolytes into your system. That comes from a real salt. That's called real salt, sea salt, Redmond salt, any of those salts, Himalayan salt, any of those salts that has a mix of all of the different positive ions that we need is what we need as far as electrolytes. And that actually helps keep the hydration within our body even more. A couple of articles there that talk about it. Multivitamin, we talked about this before, and there's an article from the National Archives in regards to multivitamins and how it helps our body be strong and recover. Vitamin D, Science Blog really gave a good summary of vitamin D and what it will do for our immune systems. Vitamin D is critical, and you can get that through sun exposure, or you can get that through supplementation. Vitamin C, again, Cleveland Clinic, they've got a pretty good reputation. Talk about how important vitamin C is, and they talk about 3 different vitamins, but vitamin C really highlights that as far as bolstering our immune system. Zinc is next on my list. Again, National Archives article, and last fish oils, and National Archives article that really talks about fish oils. We've alluded on a previous article about NAC, N-acetylcysteine. It's a simple powder. You don't need very much of that. It's a precursor to glutathione, which is the intracellular anti-inflammatory. It's a very powerful anti-inflammatory, and it can really help protect you and bolster your immune system in regards to protection and fighting off COVID-19, which, by the way, you have a 98.6 survival rate, so go with that. All right, if you do get sick, consider boosting your vitamin C intake, get plenty of rest, eat healthy, and so forth. I want to go back to the eat healthy in general. We're showing and seeing through the research that high blood sugars really help this virus spread. So keep your diet simple, eat whole foods, get off the junk foods, get off the high carbohydrate foods, and go after foods that really, really help bolster your system. A lot of vitamins, minerals, nutrients, phytonutrients, and the list goes on and on and on. So key, good diet is critical right now. Okay? All right, socially, we talked about this, connect. Take this opportunity. Don't just sit in your home. There's wonderful things out there, video connections that can be made. Connect with some old friends, connect with family. Really take the opportunity to connect socially. I think that's very important for your well-being. Psychologically, wow. Unplug for at least some time during the day. Every day you need to unplug. You need to be away from the media, from social, from fear, from whatever have. Read a good book, whatever you decide to do to unplug, but unplug for a very specific set time each and every day. Okay? Very important for you psychologically. And we know that psychologically that will drive some of your emotions. Emotions then drive cortisol. Cortisol then weakens your immune system. Hey, guess what? We're trying to protect that immune system. And finally, I would say make a plan. Plan on how you're going to move forward. That is with your family, with your life, with your business, whatever you have. Take this opportunity to plan how you're going to move forward. Okay, I think that is really one of my longest videos, but I really wanted to get some of the actual data and research out there to you, make some common sense of COVID-19. Hopefully that helps. If you have any questions, concerns, or otherwise, please feel free to comment, subscribe, and most importantly, the reality is I want this to be shared with everybody. So if you think of someone who might benefit from this, feel free, share, and let's get some common sense for COVID out there to the people. Thank you, and we'll see you next time.